All right, welcome to exam 3 review. So I can definitely do a quick overview and then we'll kind of cover where you need to focus on. So share my screen here. Any questions before I begin?
Not yet. Not yet.
Okay, let's begin and let's see if anyone else joins. Well, thank you for
Sure, of course. I've been to every single one. I mean, I hope that hopefully it'll make a big impact this time.
All right, no problem if you do. No problem if you do. So I am recording this for the individuals that had to work and cannot be present. All right, so I'm gonna share my screen here so that way you guys can see what I am talking about. Okay. We're just gonna go under online materials. And you guys do have your presentation due.
Yeah.
After that, and then we have a busy day in lab. Yes, Bonita is on as well. Yes, welcome.
Thank you.
Yep, we can hear you loud and clear. Thank you
Good.
for showing.
Hard to tell when my mute is on and off.
Yeah, I know sometimes it's a challenge for individuals to be here at 11, but it is usually my lunch hour, so I try to be productive. Every minute of the day, I'm trying to be productive. All right. So module 9. Can you guys still see my screen where it says module 9?
Yes.
Okay. So remember, you are always focusing on the objectives, right? And the main concept. So for module 9, thermoregulation is the main one. We did have some good questions last time in class. Unfortunately, they're not going to be on the exam, but it's still good for you to know so that way you can prep for the NCLEX. All right, so
the objectives and the main concepts are what we need to focus on for our exam, correct? From each module?
Correct.
Okay. And this is going to be this is going to be module 7, 8, 9, and 10, right?
Yes.
Okay.
Yeah. Well, not 10.
Oh, not 10, 7, 8, and 9.
Yes, it's only the modules that we covered so far.
Okay.
Now, I'm sorry, but when you say the objectives and the concepts, are you talking about like the ones in front of each chapter, the ones that you talk about in your recorded labs, or the ones on the PowerPoint?
Yep, so everything is fair game.
Okay.
But the main objectives should be listed under each unit.
I'm sorry, say that again.
So the main objective should be listed under each unit. So when I give you guys the the micro learning lectures, so when you guys watch Giddens and Claywell, at the beginning there's objectives and at the end there's outcomes that you should meet. Because remember, everything that we do in lab is application for what we're learning.
Exactly.
All right, so I did give you guys under module 9, simulation lab materials, I did give you guys quite a bit of information here. So be sure to look at that as well. One of the PowerPoints is exam 3 review, which I'm going to explain. Once it opens up. Okay, just let me know if you guys can see the exam 3 review PowerPoint. If not, I have to share my screen again. And
Yes, I can see it.
Okay, so you can see nursing. Okay, so when I flip to the next slide, you can see for ketoacidosis, right? You see the slide?
Yeah, I don't see the
I don't
slide.
see the slides.
I still see the Blackboard page.
Okay, Perfect, thank you. Let me share. Sometimes with Zoom, it's kind of hard to see what you guys are seeing. So that's why I ask questions. All right, let's. All right, stop share. And I am going to share again. Okay, what about now?
Yes.
So exam 3 review, okay. So we did talk about diabetes mellitus and then ketoacidosis in class, right? And
Mhm.
remember what did you guys do on that Google Doc that we had? It was a Jamboard.
Oh, yeah,
Yeah.
yeah. Mhm.
Okay, so you guys were able to distinguish between diabetes 1, diabetes 2, HHS, DKA, all of that. So be sure to look over that as well. But this is the kind of question that I'm going to be asking, right, on the exam.
Okay. I have a question for that particular slide. It says which clinical manifestation is seen in uncontrolled diabetes mellitus and ketoacidosis? I don't know. I mean, the only thing I can think was hyperglycemia. Is that what you were talking about? Or were you looking for different, are you looking for different manifestations?
Yes, great question. So I am looking for different signs and symptoms.
Okay, so then I have like polyphagia, polydipsia, polyuria.
Okay. And then when we were talking about ketoacidosis, which ABGs are we looking at?
I don't want everybody to hate it.
We're looking at the metabolic,
Metabolic, which
well,
one?
pH and metabolic. What do
So,
you,
yeah, metabolic acidosis.
right?
Okay, I had you guys look that up because in class, some individuals were confused about the respiratory because it's ketoacidosis.
Right.
So under ketoacidosis, what do they exhibit?
Under keto. Well,
What type
like
of
the
respiration?
oh, what type of respirations? Is that what you said?
Yes.
Like the fast and deep or fast and shallow?
Yeah, what are those referred to as?
Oh my goodness.
So this is what you guys should be studying, right?
Okay.
Because test questions are going to be directly coming from this.
Okay.
All right, so it's Kussmaul respirations.
Oh,
That's what you're going to be looking for. A lot of people are like, oh yeah, fruity breath. Yes, fruity
Yeah.
breath. But you need to kind of understand what's happening with ketoacidosis,
I
right?
know what it is. I just didn't know what the name of it was, but I know I feel like I know what's going on. I just didn't know what the name of it
Perfect,
was.
perfect. So you're on the right path. If you know that, great.
Mhm.
But the individuals that will be listening to this recording, if you do not know that, please reference that. Let's see, this other one here. So chronic elevated blood glucose levels can cause renal hypertension. So what leads to what in the urine,
Albumin.
right? Albumin. For DKA, what are they dumping?
Protein? No.
What am I looking for?
Oh no. They're dumping, is it ketones?
Ketones, yeah, yep. So kind of, refer to that, study that if you don't understand that. So Addison's crisis, because we did cover hormones. So be sure to understand the treatment of these crises. Normal potassium level. So I changed the exam to give you guys the normal, but you
Okay.
need to understand what's happening if they are hypokalemic. What is
Okay.
happening to their body if you're hyperkalemic? So that's important as well.
Okay, I have a question about the treatment for Addison's crisis. I just
It's a
wanted to make
hydrocortisone shot. That's
Right,
immediate, but then it has a lot of little interventions afterwards.
okay. I just
No,
wanted to make sure that it was a
Got it
hydrocortisone because
right?
I'd seen
The
a couple other places.
hydrocortisone shot, an injection. I thought that was like the immediate thing that you did right away was a cortisone shot, and then a hydrocortisone shot. And then after that, it was like, they just did cortisone to kind of level you out.
yeah, so you're on the right path. So they will give Cortef, right, prednisone. They're going to, kind of level you out with saline solution. They're going to give you a little bit of dextrose, because remember, we were trying to, what's that term that I'm always trying to say in class, or that I say in class?
Homeostasis.
Yeah, like get you back in that hemodynamic state as well, right? Getting everything back to normal. So you are on the right path. Okay. So your priority intervention with someone like that is make sure you got vitals, make sure you start IV access, right? Because when you're administering all of these as a RN, are you going to be giving them pills?
No,
No, they're in a crisis. That's the acute term, crisis.
Right.
You need IV access to IV, whatever, how many ports, because you're going to be given IV push medication. Yes, you may give some PO medication, but majority of your medications are going to be intravenous, right?
Mhm.
Because our patient is acute.
right.
All right, good. Let's see, this next question here. So does that answer your question about a crisis?
Yeah, I just wanted to make sure because I've seen a couple places where it said the hydrocortisone shot. Then I seen someplace else I was reading and it said a steroid shot. And
They're the same.
right, I just wanted to make certain that there wasn't anything more specific you were looking for. That's all.
No, you want to treat it. ATI will say, you gotta treat the condition. So obviously they're lagging because of their adrenal glands, right? So you got to give them something to boost that.
Okay.
So good work with that. Okay, so this question now, which one is the most important?
I have perfusion for this.
Yes, it's
Mhm.
always perfusion. And we talked about
Right.
right, we talked about MAP, and MAP is what?
MAP is the amount, that's the level of perfusion that the patient is in at the time the blood pressure is being taken, or the amount of perfusion, right?
Yeah, it's the level of the
Okay.
perfusion. Where do we want normal MAP at?
60 or 65, but 60 they'll satisfy for.
Yeah, I would prefer 70 to 110 for my patients, but you might get away with above 65.
Above 65. Okay.
Yeah, and just remember, if I test you on it, it's going to be something on a whack. It's going to be like,
Okay.
this person has a MAP of 40 or 49 or 39 or
Right. Just
51.
don't give us a question that says 62, 65, 66.
Yeah, I won't, and the rationale, if I do it, if I do give you something that close, it's going to have the normals.
Okay.
Yeah, the
What
normals.
is MAP the acronym for again?
The mean arterial pressure.
Oh, thank you.
Yeah, so that's how the arterial pressure, it's flowing, blood flow is going everywhere. And that's what you want. You want blood going to the brain. Okay, so perfusion is your priority. So anything regarding a hemorrhage, anything regarding a suspicion is perfusion, right? And once you start taking the vitals and you've seen that blood pressure go down, your mental alertness it should be, you know, considered, but it's not your priority. Your priority is perfusion. Okay, so with diabetes, remember, we're administering medications. What type of medications do we give?
Insulin,
Yeah,
Yep,
insulins.
glycemics.
Yep, so kind of know your insulins. We did talk about it in class. You don't have to study it at great detail, but you do need to understand the difference between, you know, short-term insulin and an insulin pen, right? Why would we give an insulin pen to someone?
Speaking of short term, I'm not short term, but just speaking of general, could you tell us exactly what we need to know concerning the EKG? Because I think I'm going a little bit off into depth here.
Yeah, absolutely. All right. I don't want to move this one.
Oh, I'm sorry. You're in a lot. Okay. I'm
So
sorry. I don't want to throw you off.
well, after I get done with this PowerPoint, I'm going to take questions and then
Oh,
we
right.
go into the EKG. But back to the question about the insulin pen. Why are we going to put a client on an insulin pen?
Mm.
So you're in a hospital.
Mhm.
Why would you have someone on an insulin pen?
The only thing I could think is maybe if it was, well, an insulin pen, you can change the dosage. I mean, you can change the amount of units that you're taking, right? So I don't know. I must have missed that then.
Yeah, you're on a right track. So have you guys ever seen an insulin pen?
Mm-hmm. I've used one before.
Okay, what does it make when you turn it?
It makes it changes the dosage.
Yeah, by doing what?
By
What are you hearing?
the clicking.
Yeah, so like a
Yeah.
blind person, an older person,
Oh,
they're
okay.
hearing
Okay.
clicking. So it's
Okay.
something that's feasible for an older adult, uh,
Okay.
or you know, any adult upon discharge,
Okay. So it's
right?
easier to maneuver. Okay.
Yeah, because I'm not going to be there as a nurse, right? We might have
Right.
home care visit a couple times, but we want this guy returning,
To be self-sufficient.
yeah, taking care of himself. So when we cover the NCLEX health promotion and maintenance, you know, that's what we're covering,
Okay.
right? So we did a lot of things regarding heart failure, right?
Mm-hmm.
So be sure you're looking at all the self-management. You guys even wrote a discussion board on heart failure and self-management. So be sure to look at all of that.
Okay.
You
I
might,
have, I mean, there was nothing that, I mean, just like basic things. You're not talking, I put like diet, physical activity, weight management,
yeah,
medical adherence,
there you
blood
go.
pressure monitoring. Okay.
Yeah, there you go. All right, thermal regulation, you know, the questions that are going to be associated with thermal regulation will be very simple. So don't overthink it. You do have some pregnancy questions on there,
Okay.
and it's really important to know that if you're on a labor and delivery floor, right, and you're making out the assignment on a pregnancy floor, so labor and delivery unit,
Mm-hmm.
it's a 1-to-1 ratio if you have a patient in active labor.
Okay.
So be sure to understand what active labor means, right? So active labor is not someone that had PROM, which means, you know, premature rupture of the membranes within 24 hours, right? And they're only 30 weeks, right? They're 34 weeks, right?
Mhm.
They're not your priority. So a nurse can actually have 2 patients if their patient is not in active labor.
Okay.
What about sonometers? Look at dilation, right? when they have to be in active labor, right? If
Mhm.
they're an older client and they only had one baby, it might take a while,
Mhm.
right? So if
So
they're,
active labor is considered the 10 centimeters dilated, right?
well, when you're making the assignment, the
Mhm.
person that's closest
Would
is
be that.
active. Yes.
Okay.
If someone had delivered a baby,
Mhm.
you do not assign them to postpartum right away. The labor and delivery nurse is still doing a one-on-one with that patient because they're at risk for what? That
Hemorrhaging.
hemorrhaging. So you are monitoring that person for an hour, for 2 hours,
Mhm.
depending on, how much time, whatever complications, the blood loss, because you guys are weighing the different sponges as well,
Mhm.
depending if the OBGYN had to suture the client, they will give an estimated blood loss. So you're factoring all that into consideration as well. So does that make sense?
It does. Yep.
Okay, and then remember before, when we did the labor and delivery unit, um, if, if a mom, that's in labor, um, if the fetus has a D cells, what do you guys do?
Um,
Are you gonna call a
you're
physician?
gonna call the doctor, yeah, right away. You have to
No,
notify.
no,
If someone
no,
has
that,
what?
Oh
that
no,
is not
you're
your
gonna
priority.
If
you're
someone
gonna
has what?
D cells.
Oh,
If the
gee.
mother in labor has D cells, right? The infant, remember what D cells is?
Mhm.
Ooh, yeah, those are not good. So what do you want to do? What's your first intervention?
Oh, oxygen,
Yeah,
right? Yeah.
yes. Okay, good. What else?
You're gonna call the provider. Um, oxygen, and then isn't this the one where you want to oh, is it move the belts or something? Move
Yeah,
the monitoring
moving is correct,
Mhm.
but it's a different type of moving.
Okay. Is that it changed their position?
Yes,
Yeah.
repositioning. What
Reposition.
side?
The left side.
Yes, why?
Because like the natural flow of
Yeah,
blood and oxygen. Yeah.
yes, it'll relieve pressure off that,
Mhm. Vagal nerve.
the
Is it
cord.
the nerve
Yes,
or the cord? Okay.
yes. Good. Give the infant
Mhm.
adequate blood flow.
Right.
So reposition's your priority, oxygenation's your
Mhm.
priority. Yes, call the provider. That's once you do those.
Right. Okay.
Um, so we've covered the teaching points, different levels of care.
Oh,
Name
okay.
3.
I have primary, secondary, tertiary, and quaternary.
Yes.
Okay.
So definitely know what each one does. The case study that we did on the camp nurse should have a good outline of that as well, if you looked at the answers.
Mhm.
And then,
Could you
obviously,
briefly explain quaternary?
so that is the last. That's the rehab and there's no recovery.
Okay.
Yep, there is no recovery and you will not be tested on that one.
All right. I kind of was worried.
Yep, only the 3. That's why I said, what are the 3?
Oh, I'm sorry. I'm
Oh, no,
sorry.
you're fine. You are fine. So be sure to look at those definitions. Look at those definitions and look at some examples. They are not going to be difficult if you look at the definitions and you look at examples. If you do not, then, you might have a hard time. Let's see. Cushing's. again, what is it? What type of patient education do you give?
I have like take medications as directed. That seemed to be the big one.
Okay,
Eat
so
healthy foods.
yeah, remember Addison's and Cushing's are
Mhm.
kind of like opposite, right?
Right.
So if you,
Manage blood sugars, daily weights, and stress.
yeah, yeah, okay. So they are susceptible to what? What's the biggest thing with them with Cushing syndrome?
Susceptible. Hmm.
Too much cortisol in their system.
Okay.
What does cortisol make us susceptible, fragile to?
Stress. Right.
Yeah, what does that do?
Infection?
Yes, infection.
Okay.
Um, so remember, what does it do? If right now, if I had stress, increased cortisol, right, what is that doing to my blood sugar? Is it
Raising it.
Increasing.
increasing it,
Hmm.
right?
Mhm.
If you're in a car accident and you're not a diabetic, would you suspect elevated blood glucose?
No.
Yes,
Yes,
I
I
mean,
would.
yes, it's a response, right?
yeah, I thought you meant if you were in a car accident, and I know what you mean, but
Any type
you're
of
talking about just
stress,
like
'Cause
a
remember,
regular.
because Angela, when we're when we're on the job or whatever, and we have someone who's non-diabetic, but yet they get
Mhm.
sick and something odd happens, the first thing we do kind of check their blood sugar, and if it's out of range, then we know
Yeah.
something's going on. So yeah, so just kind of think about that one.
there you go. Yeah. So
Yeah.
what are you going to do? You're going to make sure that they got their annual flu vaccine. You're going to make sure that they wash their hands every time. You're going to make sure that as they're, walking out of the room, they're wearing a mask, right? Because
Mhm.
again, like you said, their immune system is compromised and they are at increased risk of infection. All right, so Cushing's. Okay, like we've already went over this, hypo versus hyperglycemia. So again, know those. Let's see, what else? What else? Remember, you're always going to have delegation questions. You're always going to have dosage calculation questions. They should not be any different from what you've been exposed to.
And you're going to have the ABGs again, right?
Yes, so we're going to have ABGs again,
Okay.
but they are, if you thought that the ABGs were difficult on the last test, these are really easy. So you just
Oh.
have to respond, no compensation, so you don't even have to worry about compensation. You just
Oh.
have to respond if it's respiratory acidosis, respiratory, alkalosis, just kind of knowing it.
Okay.
You guys remember when we did the nitro patient with the heart attack, right? And
Mhm.
we said that they're on a nitro drip and their blood pressure is this, and what are you gonna do? What did I tell you?
Titrate it. I mean, just depending on
Yeah, so depending
what
on,
levels, it's just going to be titrated either up or down.
yeah, you don't stop it like heparin, because
Right.
then that chest pain is gonna come back really
Right.
fast, but you try to control it. What do we do in clinical? What do we do in lab, right? You gave a bolus. You were trying to maintain them. So good. So hypo versus hyperglycemic. Okay, you guys got that. Let's see if you have any meds on this test. So yep, a nitro drip is on there.
Okay.
let's see, nitro.
And then like Benita was saying, with the EKG strips and things like that with those, is there anything like real specific you want us to pay attention to? Or even with the wounds, is like the different stages? Was there anything? I mean, the
The wound-
game I thought was really helpful. That was really, really helpful.
The wound should not scare you on this exam,
Okay.
but on the final exam, because you guys will be covering, the next one.
Mhm.
You might have 1 or 2 questions about wounds
And the next exam, is that what you're saying? Or this one?
on the final exam.
Oh, okay.
Yep. So cortisone, I mean, kind of like your prednisone.
Mhm.
You don't have to know everything about it. Just like you guys said in this review, patient education. If you're giving someone a lot of cortisone, right, and they have elevated cortisol, they're going to be at risk for infection. All right. So hypoglycemic, Angela, you were kind of just saying some, signs and symptoms with that. So make sure you guys are aware of that. All right. So let's see. I don't think I have any crazy medications besides nitro, cortisol, and then ibuprofen, and then vancomycin.
Okay.
Why should you guys know ibuprofen and vancomycin? Well, that's for you to look into those medications and see which organ it attacks.
Okay.
Did I see a slide on the review slides, something about Nagli's rule?
No,
Or was I just looking through something else?
no, you were looking at something else.
Okay, thank you. Well, can we get to EKGs now?
Yes, ma'am. All right, EKGs. This is what you guys need to know about EKGs. All right. Let's see if you can see my screen. All right. Here is. All right. Did I lose you guys? No. Okay. Everyone's still on. All right. Okay. Can you guys see my screen?
Yep.
Yes.
All right. So when I say look at, if we do these case studies in class, they're important.
Mhm.
So if you guys aren't using this to study, you should. So this EKG, what was this?
AFib.
Yeah, AFib, because there's no P waves. So this is what you should know for the exam. So
Regular, irregular. Okay.
is there a P wave present? What's the PR? What's the QRS? And then interpretation. It's not going to be a dysrhythmia that you were not exposed to. Right? So it's going to be a dysrhythmia that you were exposed to on either a case study or in lab. Mostly case studies. I know I gave you that EKG game or whatnot, but just focus on the case study. Does that make sense?
Yes.
Any other questions?
Not right
No.
now for me.
All right, you guys got this. We're gonna do the exam at 3 p.m. Thursday, 2:45, and then afterwards, we're gonna go to lab, do our presentations. I'm hoping that Dr. Brooks can come and talk to us, and then we'll go from there.
Okay.
All right.
Thank you.
I believe Angie,
Uh-huh.
you said that the exam, I'm gonna do a exam blueprint, because remember, this one I believe does cover up to week 10,
Mhm.
because you guys had this case study and the dysrhythmias are there as well. I think I said week 9, but it's actually week 10. And then the final exam is going to be on the final 2 weeks, and then everything that you've covered in class. All
So
right.
it
So
is
this
module
exam-
10 then?
Yes.
Okay.
7, 8, 9, 10 as well. There's only a couple questions from 10.
Okay. Okay.
I'm going to give you guys a blueprint as well. So,
Okay. I
all right.
appreciate it. When are you gonna start, Ben, for our final? Are you planning to have a review session for the final exam?
Okay, so I have, can you guys still see my screen?
Mhm.
Okay, so go to learning modules,
Okay.
and then go under week 12. I opened up everything for you.
Okay.
And then when you go under continue, why is this 11? I thought I clicked on 12.
I thought you did click on 12 too.
Okay, once you click on 12, there is a blueprint for the final exam.
Okay.
So you guys see this final exam blueprint?
Mhm.
Okay.
Okay. Well, thank you very much. I really have to go. Bye-bye.
Thank you, guys. Email me if you have any additional questions.
Okay. Thank you.
Bye.